Many of these forced birther states are in their find out season. The way they are running off medical professionals is going to harm women, and these women and girls should know that they are in danger. And if they can get away, they really should find a way to escape these places. And if you don't live there, obviously reconsider going to these places. Now, this is out of NOLA.com. Is Louisiana's Smbortion ban costing the state future doctors? New data shed light. All right, let's get into the article. Hannah Doran never wanted to leave New Orleans. The 33-year-old physician stuck close to home for college and started a family in Mid-City, the same neighborhood where she grew up. When she applied to medical school, she sent in just one application to LSU Health, New Orleans. But when it came to apply for the OBGYN residency, Louisiana wasn't even a consideration. I knew that if I stayed here, there's no way I was going to be able to meet the standard ethics that I aspire to. I didn't want to add that, I didn't want that added stress of being like, am I going to have to risk my license or go to jail just to follow my conscience? Doran is a part of a growing number of doctors on the front lines of women's health care who are factoring in state laws into their decisions about where to learn and practice medicine. According to a May analysis from the Association of American Medical Colleges, Louisiana and other states with these strict bans show a drop in residency applicants in comparison to states where women's rights are still respected. For residents who do choose Louisiana programs, the required training in Smbortion and miscarriage care takes them thousands of miles away for a short rotation with limited clinical experience. Applicants drop. Over 100 fewer people applied for the OBGYN residencies in Louisiana in the 2023-2024 cycle, according to the AAMC analysis, a drop of nearly 18%. Overall, residency applicants in all specialties decreased in Louisiana by 1,229, almost 15% from the prior year. Although AAMC has encouraged medical students to be more targeted with applications, leading to a nationwide decrease, Louisiana's drop in applicants is more significant. When grouped with other states that have these strict bans, the numbers show that the ability to practice the full scope of reproductive care may be influencing where residents train. The number of applicants in states with near total bans decreased by 4.2% compared with a 0.6% drop in states where Smbortion is still legal. People seem to be disproportionately decreasing their likelihood of applying to programs in Louisiana, says Dr. Atul Grover, Executive Director of the AAMC's Research and Action Institute. We think at least part of that is due to some of the restrictive laws around reproductive health care. In Louisiana, Smbortion is banned except to save the life of the mother or in the case of some fetal anomalies. Doctors, hospitals, and patients have struggled to interpret the law, and that's a challenge many new doctors don't want to face while they are still trying to learn how to practice as an OBGYN. You really have to be in peril for someone to get a medically indicated Smbortion, and that line of peril is very gray. How almost dead do you have to be for me to provide this service to you? Louisiana's 5 residencies program filled all of their OBGYN spots, according to the AAMC data, but fewer applicants means programs had a smaller pool of new doctors to select from. They may have to take candidates that are less of a fit for their particular program. Louisiana's Right to Life, an anti-Smbortion group, has pushed for limited access to Smbortion, said data in the study, which spanned the 2 years before and after Roe fell, was too limited to draw conclusions. The group also noted that applicants decreased in other specialties such as pediatrics and internal medicine. The percentage decrease in these specialties certainly cannot be directly linked to Louisiana's forced birther laws, said Communications Director Sarah Zergowski in an emailed statement. Zagorski also said individual states with access to Smbortion, such as Massachusetts and California, also saw drops in OBGYN applicants. The challenges are present across the country, whether in forced birther states or states with reproductive rights. Grover, the analysis author, acknowledged that the data is limited with only 2 years since the bans were instated. What you got is a correlation, and I can't prove causation. Now, when you talk to medical students, they will certainly tell you this is a factor. Lost generation of providers. Smbortion training is a requirement for OBGYN residency by the Accreditation Council for Graduate Medical Education, the accrediting board for medical training programs. Prior to the ban, Louisiana residents mostly traveled to Shreveport's Hope Medical Group for women for Smbortion training, learning the same procedure used for miscarriages. Now, LSU residents travel thousands of miles for a 2-week rotation. Residents at other programs in Louisiana can apply for out-of-state family planning rotations, but there are obstacles. They immediately have to learn a new medical record, learn a new hospital, learn new faculty and new colleague residents, said Dr. Stacy Holman, Associate Professor of Obstetrics and Gynecology at LSU Health, New Orleans. Oregon Health and Science University Center for Women's Health received 3 applications for their out-of-state rotation from Louisiana residents this year. 2 will get training there during a 4-week rotation in the coming year, said Alyssa Colwell, who leads the Ryan Residency Program. This is whack, but their home programs may not provide them with a salary while they're away, and they have to get licensed in another state. Over time, those barriers will lead to fewer Louisiana doctors with experience in miscarriages and treatment when a Smbortion is medically necessary, says Caldwell. We're further limiting the number of people that have all the tools available to them to take care of the patients in the safest way. I absolutely worry about having a lost generation of providers in the future. All 4 of LSU's graduating OBGYN senior residents are leaving for other states. There's just 4. It says all 4 of their residents are leaving for other states, said Holman, a trend she has seen in other state programs. During the 4-day training as a medical resident at Shreveport's clinic in 2022, Dr. Lou Rolt didn't ask patients why they were getting a Smbortion, but the stories poured out anyway. She saw pregnant teenagers who were getting their first ever pelvic exam. There were people whose partners refused to wear condoms or said they wanted to have a family, then ghosted. One patient said a long-term partner lied about having a vasectomy. That one just really hurt me, said Rolt. Then a 4th-year OBGYN resident in New Orleans. There's so much reproductive coercion. By the time she finished her residency, Rolt had been in New Orleans for 8 years. She grew close to the patient population and put down her own roots, but she didn't feel like she knew enough from her limited training, even before the bans, to understand how to provide care for patients, including those who miscarry after 13 weeks. She had to leave. For current residents who don't get more training, what they see in the hospital for miscarriages isn't enough to be skilled in the procedure. With the volume that they have, it's not nearly high enough to get adequate training, said Rolt, now completing a complex family planning fellowship on the West Coast. None of them are going to graduate being able to do Smbortion procedures after the first trimester. Smbortion opponents have said that doctors can still practice within the scope of the law, and in the past, Governor Jeff Landry has said that people who don't like Louisiana's ban can move. Doran never thought that would be her. Last week, she packed up and drove to Cleveland, where she will be an OBGYN resident at Metro Health Case, Western Reserve University for the next 4 years. She cried inside the century-old fixer-upper they purchased in Ohio, thinking about her hometown is where her dream of becoming a doctor sprouted as she bartended and waited tables in her 20s, listening to people. It's where 4 complex pregnancies and a stillbirth moved her to pursue a specialty in OBGYN. I went to medical school because I want to take care of my people, my community. If I never go back, it's not because my heart isn't there. It will be because I can't. And like Governor Landry said, if you don't like it, leave. And people are saying, I bet. They want to help people, but they don't want to risk all of their time, energy, and money and having to go to jail because they felt compelled to help these women. So where are the women and girls that stay going to stand? Jump in the